Welcome to Broadlines,
a weekly video podcast where real headlines meet real conversation.
And today we're talking about breast health at every age. I'm Natalie Lizarraga.
And I'm Rae Williams.
Today we are joined by a special guest, Dr. Heather Richardson, the Bedford Breast Center in Beverly Hills. She is a breast surgeon. You work mostly with breast health. We want to make sure everyone knows it's not cosmetic.
Correct.
We want to welcome to our show today. This is such an important topic for all women out there, so we're so happy to have you.
Yeah, it's what I do every day. I absolutely love it. I have just the best job in the world where I get to take scared and worried women and usually lead them into a place where they feel healthy and confident and happy. Most people don't have breast cancer, thank heavens, but those that do, we have amazing solutions and really good treatments nowadays that are very successful.
Just at its baseline right now, I just want to make sure we start with what is breast health? Because I know we have full bodies and a healthy body is different from just that specific having healthy breast.
Embryologically, anatomically, the breast is a modified sweat gland. So we have a thing called a milk line. It goes from our armpits down the center of our chest and into our groins. They're a very responsive organ, and it's a very dynamic organ. And by that, I mean you're getting signals from your body, hormonal signals that are changing your breast tissue throughout your life. And it's important to remind people, a 13-year-old breast is very different from a 20-year-old breast, which is very different from a 60-year-old breast, which is very different from a 90-year-old breast. So there's constant changes that are happening throughout our lives, and it's one of the most dynamic organs we have. Part of what we do is screening, making sure that we're looking out for cancer, and then educating people on how to try to optimize your own health to keep cancer from happening unnecessarily. And then other things like pain and infection and breastfeeding issues, we take care of those too.
When you have patients come in, what do you think the biggest myth is that they have about their breasts?
This idea that biopsies spread cancer. This idea that there's a huge amount of radiation in a mammogram and it's very dangerous, and mammograms can cause cancer, or the compression of a mammogram can create cancer or spread cancer. The idea, what is early, like an early catch, and even doctors fall victim from this. I've even had patients tell me their own doctors will say, oh, you had a clean mammogram in January. If you had your mammogram January 1st and it was all clear and you felt a lump on March 30th, then that means that lump grew between January and March. No, there's a lot going on under the surface that is beneath the threshold of detection.
And what do women come in worrying about usually that they maybe shouldn't? That's like maybe not that big a deal.
The biggest thing people come in worried about unnecessarily is pain. I would say a certain percentage of my practice are women who come in because an area hurts, either it's sore or it's tender or shooting or burning pain. They think that it's cancer. They think that it's something really dangerous. Or even, pain that comes and goes that isn't there anymore, but they had it 2 weeks ago and they're still worried that it's a hidden cancer. Usually that's not the case.
So let's get back to, you had just touched on imaging. And I think most women, if they don't know or maybe haven't had one, what is a mammogram specifically?
What a mammogram is it's a device that takes a woman's breast and it basically compresses the breast tissue to make it as thin as possible. And then it passes radiation x-rays, which are captured by the plate at the bottom, and it creates an image so that we're kind of looking through the tissue. And we usually take two pictures, so one from the side and one from the top down, so that the idea of kind of looking through the tissue to see what's the overall tissue pattern, can we compare breast to breast, and can we compare year to year? The pressure with a mammogram. Have you ever had your blood pressure measured by a blood pressure machine? Like where the very first time that blood pressure the cuff takes your blood pressure, it kind of hurts a little bit. It gets really tight for a second and then it goes away. That's about the experience of a mammogram. If it hurts, ways to make it better is to come in the right time of your cycle. So breast tissue is usually less sensitive after your period. It's perfectly fine to take some anti-inflammatory medicine if you can, like Aleve or ibuprofen, or even just a Tylenol, something to decrease.
Take the edge off.
Take the edge off if you want to.
How long is the entire process?
It usually is less than about 10 minutes for an ordinary screening mammogram. If it's somebody's very first study, there's about a 20% chance that there might be something in the imaging that we say, hey, what's that? It doesn't mean it's cancer.
Right.
So it's important to know if you get called back or if something is flagged, it doesn't mean it's cancer. It just means we're being really careful. We just want to make sure we're not missing something.
What are things that you can find in breasts that aren't cancer?
The tissue pattern can be a little uneven. So there's a thing, if we're looking through all the tissue at once, all through one direction, then sometimes the tissue can get piled on top of itself where we can't tell, is that like a growth or is that just tissue that's piled on top of itself? So what we sometimes do is bring people back and kind of press on it and try to kind of look through it. And if we can look through it, then that's usually tissue that's just asymmetric density. It's just extra density that is not actually a growth or a mass. There are lots of healthy growths that can occur in the breast tissue. There's also fluid-filled bubbles that we call cysts. Breast tissue makes fluid. That's its job. So sometimes the fluid can get sort of stored up or caught up in the tissue where a little bubble of the fluid is made. It's not bad or dangerous as long as we're convinced that it's just a simple fluid-filled bubble.
And then is the mammogram the preferred form of imagery for breast health? I know some people are like, well, ultrasounds are a thing. And then we see all these pop-ups of all of these new scans that, the 3D imaging and the, all these different things. And I think it's hard for us to sometimes know which one we should be doing. Is that the standard, the mammogram?
Mammogram is sort of the most studied, the best understood, the most reproducible, and the simplest. So it's a really great tool that kind of universally gives us a lot of really basic information on most women. We need to look at about 3,000 women in order to trip over a cancer. Now, if somebody has something they feel in their breast tissue, if they feel a hard, painless lump, that is something we absolutely want to check out. So that's something that, could be a cancer, probably won't be. There's lots of healthy reasons to have a hard, painless lump as well. But those are the things we definitely want to check out. So something where it's where if your tissue is puckered in, if your nipple is pulling in, if you have a firm, hard lump that's not just going away, that's something we would want to check out. We often do that with a diagnostic mammogram where we're looking very closely at that area to see what the characteristics of the tissue are, where we do extra images of that area, and usually the radiologist gets involved and gives you immediate feedback, as well as an ultrasound. So we usually want to look at that area. Now, ultrasound is an amazing tool. It can be used in almost anybody, any age group. There's no radiation in ultrasound. You usually get some really quick feedback with the doctor looking at it immediately if the doctor's not performing it themselves, if you've got a tech doing it. It's a really great way to get information about tissue. MRI is another way that we usually use advanced imaging where we're looking at blood flow patterns inside the tissue to see if someone has dense tissue, could there be a growth hiding inside that dense tissue, and is it something we need to know about? So MRI is the most commonly used tool for that. There's contrast enhanced mammography, and then there's a thing called breast CT or Vera scan as well. So,
and what's something that people don't worry about enough? Because I'm sure you see people come in and worry about things that they necessarily shouldn't have, like we talked about earlier. But what do people come in not worrying about enough?
The hard, painless lump is really the big red flag. Most people, if they feel a lump, they usually get it checked out. And the great news is again, there's healthy growths called fibroadenomas. There are other overgrowths of healthy breast tissue where there's just disorganized overgrowth of the breast tissue that's not cancerous or precancerous. And we can usually figure that out with imaging, or maybe we go to a tissue sample just to prove the nature of the area. There isn't really any one thing where people miss it. Most people are overly concerned.
In terms of lifestyle, what are some of the things that we should be concentrating on, thinking about, maybe even worrying about that actually connect to breast health that you might not think of?
Well, it's funny. People ask a lot, like, what causes cancer? Like, why can't we figure that out? And the answer is we know what causes cancer. Cancer is a cell that makes a bad copy of itself. And then that bad copy continues to make other copies, and sometimes additional mistakes happen in the replication of the cells until the cell line has changed and it doesn't want to be a happy cell in the body anymore, a nice citizen in the body. It decides to be a little anarchist. So it's appreciating that general good health, the things that give us good health and the things that keeps our bodies healthy and allows our bodies to repair themselves, avoiding stress, having whole food plant-based diets, avoiding alcohol, getting good sleep. That's one of the best things you can do, is to get good sleep, which is not easy to do. Exercising regularly. All of these things that promote general good mental and physical health are going to keep you from getting breast cancer.
As you can see, I'm guilty all throughout this. All throughout this episode, I'm like, sleep, don't know. Earlier on in life, because I think we start kind of worrying about breast health maybe when we're, old enough to really have enough boobs to worry about. Is this something that even in our earlier years that we should be thinking about and concentrating about?
I think the message I would want to give a really young girl, like mid to early teens, or a mother of a teen or an adolescent, it would be, number one, having open discussions about family health, so that what's your family history. Who needs genetic testing? Is there anything in the family that we need to know about? If mom or sister or aunt had breast cancer or has fibrocystic disease or a lot of cysts, is that something maybe this young woman should be prepared to possibly experience and not be afraid of?
I had a friend who was diagnosed with breast cancer at 39. And I think one of the things I'd love for you to talk about is just dispelling this myth that breast cancer is an older person's disease.
We are finding more breast cancers in younger women, and that is terrifying. And why is that? The idea is, could it be chemicals or things that we're exposed to in our environment? It could be, but it's more likely to be changes in our body. We are heavier than we have been, and with fatty tissue on our body comes increased estrogen levels. And the other thing is we're not having as many babies as early on as we used to. Having babies, being pregnant at a younger age is protective against breast cancer. Breastfeeding is protective against breast cancer. A lot of women are really waiting into their, late 20s, early 30s, and even 40s to have their first child. Whereas before, a lot of people had their first baby as late teens and early 20s. So it's a very different environment. The great news is that the types of breast cancers that typically will kind of swoop in and take the lives of younger women, we've had some really amazing breakthroughs as far as chemotherapy and medical treatment.
Does breast size actually matter? Because as we talked about, you see all these sexualized images of breasts and people tend to compare. And I think when I was younger, the thing that I kind of understood was, part of the itty bitty titty committee. So, I don't have anything to worry about. Only to find out later in life I actually have fibrocystic breasts, which I was like, well, I don't even have that much. That's not fair. But tell me about the difference in breast size and how that contributes to either risk or screening or any of that.
So 2 things. A lot of people want to know 2 things. A, am I at increased risk for breast cancer? And B, how am I going to be at breastfeeding? So as far as size is concerned, I can't look at anybody and be able to predict whether they're going to be a good or a bad milk producer or if they're going to have an easy or difficult time breastfeeding. That's hard to tell. A person can have a lot of breast gland tissue and it just doesn't function very well when it comes time to feed that baby. Another person can have barely there breasts that are just very efficient powerhouses that are great efficient milk makers. So there's that question. As far as cancer, there's a thing that we haven't really touched on, which a lot of people want to know about: density. So if someone has dense breast tissue, then we have to understand it's going to be harder to find a cancer. So what are we going to do to overcome that? How are we going to look through the tissue and have additional layers of information to make sure we're not missing something? That can either be ultrasound, where we're looking through with the sound waves and kind of looking through to make sure that there isn't anything we see that way, or where we have to put an IV and put IV dye in the bloodstream and do a test where we look at blood flow patterns. So those are kind of our choices with dense breast tissue.
Yeah. So it's less about the actual size and more about what your actual
density.
Tissue is like and the density that you have.
Someone can have a small breast that's very dense. That person has a higher probability of having cancer or having it missed versus someone who has a very large breast that's very fatty and the breast gland tissue itself is very wispy like spider webs. It should be really easy to see a cancer if there's one there, or feel one if the breast tissue is really soft.
Never heard anyone talk so beautifully about breast tissue.
I know, right? I'm like the spider webs and
I want to look at it.
I have so many analogies. I've done this for many years.
A question for you here is, once we get to 40 and then they've recommended as of 2024 for those mammograms to be earlier than they used to be, what are we doing 20 to 39 to make sure that we have optimum breast health, that we're aware of the changes that are happening in our body and I love that you do this because it's really refreshing that not everything you find is going to be cancer. And I think you go thinking this is it, and you're pointing out that there are healthy things that you can feel that aren't necessarily bad. And I think that kind of takes back a lot of the panic that people might be having, listening right now, thinking maybe I have something, but 9 times out of 10, or as you said, like a lot of times, it's not that bad.
Most things aren't cancer. And even the things that we find that we do have to take action on usually are contained when we find them. That's just statistics. So the things that we sometimes feel are things like that feel bubbly or slippery if you go to press on it and it kind of shoots out from under your fingertips like a bubble that you're trying to press down. That's usually a healthy sign. It's usually a cyst or a healthy fibroadenoma, which is like the breast tissue equivalent of having a flesh-colored mole or a skin tag inside your tissue. So those are things we can usually tell really easily with ultrasound. That's usually the best way to kind of check those things out.
So pre-mammogram, since
for 20,
for 20 to 39, what are we doing to stay healthy and what are we doing to check?
Appreciating with a breast exam, going to your primary care doctor, your OBGYN, to let them do a clinical breast exam with their hands to make sure that there's nothing that they feel and then addressing anything, usually with either mammogram or ultrasound first, if anything is found. And the other thing, remember, is talking to your family. We talked about that before. Right. If you have a relative that had breast cancer at a younger age, we want to subtract 10 years, and we want to start your screening earlier. So we usually recommend mammograms and screening at 40, but if your 35-year-old aunt had breast cancer, then we probably want to get you in at like 25 or 20. So for examinations and evaluations with imaging.
Now, if people find something, what should they do? Because I know even for myself, I found a mass and my first thought, I was 20 something. I didn't even have a primary care physician because let's be real, I was out in the streets drinking, like having the greatest time of my life. And my first thought was, oh my gosh, who do I even go to? I ended up going to my OBGYN because I've known her since I was like 10 and she was like the only doctor I could think of. And then she wasn't in office that day. It was like someone filling in for her. And I was like, but what, especially for, younger girls who might be doing their breast exams and taking the proper precautions, if you find something, where can they go?
Really, we want to do some imaging. We want to take some pictures and look inside the tissue. It's so easy to do an ultrasound. Mm-hmm. We don't often have to jump directly to mammogram in younger ladies. Sometimes we do, and some centers want to do that mammogram with an ultrasound, but at the very least, just looking at it with an ultrasound is really quick and simple. So an imaging center, just call an imaging center and say, I feel a lump in my breast and I want imaging. Sometimes they want an order from a doctor. Sometimes the patient can't come in just alone.
I will now say there's the Young Survival Coalition, which is a website that helps women who've been diagnosed with breast cancer. And they said that nearly 80% of women diagnosed under the age of 40 find those abnormalities themselves. Mm-hmm. The importance of having self-awareness and reporting changes in your breast. But I would like you to speak to the women who are like, I exercise every day, I eat healthy, and I continually keep putting off this test because I don't feel anything and everything is fine. Quote unquote fine. And maybe they're in their 40s, but have never had any problems or anything, but they're still not having a mammogram.
If a single person said, I don't want to do a mammogram, do I think that person would die? Probably not. I would just strongly encourage them to figure out why don't they want the mammogram? What's keeping them from getting it? If they have biases or if they're concerned about radiation or compression, again, those aren't issues.
A little bit earlier, you talked about risk and you said, if you had an aunt that, had breast cancer at 35, that's something that you might want to hop in there earlier and take a look. What are some of the other risk factors that people might want to consider? And I know we talk a lot about I think in terms of females, so we say aunt or mom or grandma, but even on the paternal side, what should we be looking for if there is anything to be looking for on that side in terms of risk as well?
Genetic mutations, if you have a family history of certain diseases in the family, whether on the mom or dad side, things like melanoma, prostate, breast, ovarian cancer, those especially are reasons to consider getting genetic testing. In this day and age in the United States, for the most part, if a young person has sort of an aggressive cancer or a cancer at a younger age, in general, they're getting screened for a genetic mutation. And hopefully, if they find they have that genetic mutation, they're sharing that information with their family. The issue really comes when you have, an aunt or a grandmother that either passed away many years ago and you just don't have the luxury of having them tested, or they had cancer many years ago and we didn't have these recommendations and they don't know that they should be tested now. So talking with your families and seeing, hey, has anybody had any genetic testing? And if so, are there any results I need to know about? Or did you have genetic testing? Hey, aunt with cancer, did you have genetic testing when you had cancer? Oh, you're negative. Okay. It doesn't mean that someone else might not have a broken gene, but it's less likely.
And I'm going to ask a question that people are thinking that they might not want to ask, which is if you want to alter your boobs, if you want to get new boobs or take some of your boobs off or in other ways alter them, maybe even get a nipple piercing, is any of that a contributor to breast health?
In general, piercings can create damage to the nipples and with issues with breastfeeding and can increase the chance of a local infection in the nipple sometimes, just because it blocks the milk duct passage and sometimes germs can get stuck inside. It's not the piercing that gets infected as much as it causes an obstruction in the surrounding nipple ducts and sometimes can create a downstream infection in the tissue that's beyond the piercing. As far as implants, we have no reason to think implants are safe or not healthy. There's a lot of information about breast implant associated illness, and also there's in the past there was a specific type of implant that was textured to try to reduce scarring and gripping and tightening around the implant called capsular contracture. And And some of these implants have an increased association with some irritation around it that can be associated with lymphoma around the breast. It's a very rare cancer. It almost never happens. People got very excited about it. If it does happen, for the most part, just removing the tissue and removing the implant usually takes care of it. If somebody wants implants, we're all for them. We're totally comfortable with screening around implants. You don't have an increased risk of getting breast cancer or a harder time finding it, but we do have to take some more pictures and we do have to look around a little bit more. And ultrasound is a great idea if you have implants. As far as breast reduction surgery is concerned, if someone has very large breasts, there's a very minimal, because we're removing some of the tissue, it's like, oh, we're getting rid of some of the tissue. Are we going to decrease breast cancer risk? The answer is breast cancer happens more often in the upper outer quadrants where there's more of the active milk-making tissue. Being primates that were upright, most of the milk is made here and then kind of flows downhill. So just embryologically, evolutionary changes, there's usually less breast tissue in general in the other 3 quadrants of the breast. So most breast cancers happen in the upper outer portions of the breast. So when we remove tissue for a breast reduction, we don't remove it from there. We usually remove it from the lower central portion. So we're not usually taking the hot spots where cancer is formed. So I'd love to be able to tell people we're decreasing your risk of breast cancer with a breast reduction, but sadly is not as impactful as we would like it to be.
Growing up, there was the basic stuff that we talked about in like biology where you're like, this is your body, this is your period, these are your boobs. Thanks, go to lunch. And then you never really delve into like, and then they also might look like this, or they also might change. And when you get pregnant, it's this way. And like, I don't think the female body it's kind of weird. It's like we all have them, right? But not everybody knows exactly how they work, even if you're the owner of one.
Well, and I get asked this all the time, like, well, if my breasts are lumpy, how do I feel a lump? How am I supposed to feel a lump in all of these lumps? We don't have an understanding of like, well, what does a little piece of fat feel like versus what does a piece of healthy breast tissue feel like? And again, come on in. I'm always happy to see somebody. My favorite thing to do is tell somebody that they're very, very healthy and that there's nothing wrong with them. So I love telling healthy people that they're still healthy.
I think that's great for like early education of moms out there with teen girls or teenagers in general, that like you should do the self-breast exam to feel what it is to feel normal, so that you're used to, like you said, that you're used to your car and you know when something might be off, as opposed to the search for dread, which I think is a really important message to everyone out there, that you're not looking for cancer, you're just making sure everything feels the same.
And fibrocystic disease is basically just a medical term saying breasts are uneven and they change. They swell, they shrink, they feel harder, they feel softer, they feel uneven. And it's not necessarily a disease or a bad thing or a subset of a person where they're special or we need to be really concerned about them. It's just sort of a way of explaining that breast tissue is lumpy and it changes.
Did they change the language around? I know they told me I had fibrocystic breast disease, and the only word I heard was disease.
Yeah,
and I was
I
like,
hate
well, the girl's
that.
got to go.
I hate that. It's no more of a disease than acne is a disease, but it is a spectrum. So, if someone has a couple of pimples over the course of their teenage years, they've had acne, but yet some people, they need help with it. They have, cystic acne and they need a lot of help with it. So in the same sense, sometimes, women have lumpy, uneven breast tissue that may be sore or tender or fluctuates with their periods, and they get through it and they're not worried about it, and they understand that can be within normal limits. Other people have horribly painful, really lumpy, hard to evaluate breast tissue, and they're on that other end of the spectrum. And women, because we don't have the luxury of being a breast surgeon who's, doing breast examinations all day long and feeling all of the gamut of changes, you don't know what's normal. All you know is what you have. So it is hard to appreciate, how do you feel a lump on a background of lumps?
We've been talking so much about the science of all of this, and you work so closely with people who are getting reconstructive surgery. Can you talk about the emotion, the what goes into it, the mental and the emotional part of, this is part of our body. If you're losing part of your breast, you're getting reconstructive surgery. I remember my best friend had breast cancer, and the biggest thing, she was like, I don't feel like myself. And I didn't think it would be a big deal because I felt like I'm getting healthier. They're taking it out. She had a mastectomy. And she's like, but I just feel like this alien without my boobs.
What has never failed to amaze me is the vast degree of responses I get for the same scenario. Well, I can present something, ma'am, you have a very small cancer. It's very treatable. I think you have a great prognosis, and I do think we're going to cure you of this. I think that you're going to live past and through this. Our choices are to do a small tissue removal, a lumpectomy. We can talk about adding radiation, yes or no, or we can remove your whole breast with a mastectomy. And I can have two women in the exact same scenario, and one woman will say, oh, how dare you suggest you take my breast when I just have this tiny cancer? Like, who would think that? And someone with the exact same scenario will have the exact opposite. Are you kidding me? Why would anybody leave this behind? They tried to kill me. Get rid of them tomorrow. So just as many people feel tied up in their identity, they want them to be perfect. They want them to be beautiful, their gender identity, their sensual identity, and they want to be as perfect or even better. Like, not only do I want the cancer gone, but I want I want a lift, I want a reduction, I want them bigger, I want them gorgeous. And some people are like, you know what? I've never really liked them. I want them gone. I've always wanted them gone. They've always been in the way. I can't wait to feel sleek and feel free of this weight and this presence of this flesh. So everybody's response is so different and valid.
I will tell you in the same vein. So I was 20, I want to say 6, and I just actually had my hand like this at work, like inside my shirt. Don't ask me why, and felt a mess. And this is what I was telling you earlier, is that I was like, okay, who do I even go to? But I think the kind of message at the time and the fear that we have at the time is, if you find something, it must be cancer.
This is not a process for the most part that happens in seconds, hours, or days. It's a mental torture, but usually for the most part, if it's a week or 2 weeks or even a month to get in to have it checked out, usually nothing's happening in that time interval. I'm not saying it's fine to wait. We want to get people in as soon as possible to give them answers. We don't want to miss things. But again, I don't like the word early. I really like the word. Most things are treatable and contained when we get to them. And usually days, weeks, even months usually does not impact treatment that much. There are exceptions to every rule, but I don't want people panicking, thinking if I can't get this taken care of today, I'm going to die. That's usually not the case. There's lots of hope.
But I think at the time it was just the most
get it checked
logical
out.
thing.
Definitely get it checked out.
Get it checked out.
Pick up that phone.
And
make that call.
eventually I did. And like you said, it turned out to be fine. I think that was the point at which I started realizing what breast health was about, and what, like, that's the first time I knew that you could have cysts. And he did ultrasound. He said, well, you have like 26 cysts in this breast, because they did the breast that didn't have it first to kind of compare to the other breast. And I was like, and I heard that and I'm like, what do you mean I got 26 cysts? Like, what do you do with those? Like, so I think it's really important for us to know that, exactly what you said, that a lot of these situations, it's best to be aware, and people do turn out to be fine. We didn't actually ever figure out what it was. It wasn't a fibroadenoma. It wasn't anything.
Probably just what we would call a fibrocystic nodule, just healthy concentrated breast tissue that was either more swollen with fluid shift changes and just a little bit harder texture. If you still feel it, it's probably just your own. Out. Oh, okay.
Yeah. They were. And it was really funny, because that's the other thing too, is that you have to, go through any kind of procedure. Like, you immediately feel like, oh my gosh, like, am I dying?
How many years ago was this?
This is in my 20s. So I was 26. I'm 36 now. So about 10 years ago. And I will say this was in Jamaica. So our, screening and all of that is I would say a little bit behind the US. I think in different countries, as you said, there's different recommendations in different countries. Things take a lot longer. The imaging takes a lot longer to come back with. And I think that's an important thing for us to mention, is that, you, depending on where you are, you might have to be a little more vigilant or follow up a little bit more.
If you feel like you're not getting the answers that you want, and something I counsel my own patients, if I'm looking at something and say, I don't think this is cancer, I think it's totally safe, but you have that little sneaky feeling in the back of your neck and you feel like, can we please just take a tissue sample? Have that conversation with someone. Feel free to advocate for yourself and say, I know you're telling me, but I feel like I don't have all the answers I need. What can you tell? Can you tell me why you think we don't need to do anything else? And if we could do something else, what would that look like? Would it be a tissue sample? Would it be more imaging with something like an MRI or an ultrasound or a mammogram? Like, what do we need to do to give that additional layer of information or confidence? And if somebody tells you, oh, we see this thing, it's fine, it's a cyst, it's healthy tissue, but then it changes, go back, have it checked again. I warn people, if something changes with this area, I don't see any signs of cancer or infection today, but if something changes and you feel like it's getting worse, it's getting harder, it's getting larger, or something's pulling in or pushing out, let's check it again.
I think that's also amazing advice coming from you as a doctor too. You can question your doctor. You can ask questions. They're not the be all end all. You can sit there and take time to go, well, what's next? What should I do? Is there anything else that we can do to make sure? Because, I mean, like you said, when you hear lump or any sort of growth or anything, you immediately get into a paranoid state.
Yeah, I think there's a difference between WebMDing your doctor and asking questions. Is there anything else that women can do to kind of advocate them for themselves, whether that is, with a doctor, with their doctor, or just kind of elsewhere in life?
So when people's cycles become irregular, the fluid shifts in the breast tissue become really irregular. So when we were, 12, 13, 14, 15 years old, we got pimples on our face. When we get into our, 40s and 50s, 30s, 40s, 50s, we get cysts in our breasts, pretty commonly, and a lot more pain and changes, things that we've never felt before. Suddenly we're feeling. Another thing about menopause is a lot of people say, well, why should I go through the change? And why don't I just hold on to the youthful hormones? And why don't we take hormone replacement therapy? There's a lot of studies to say that there's a lot of good support with hormone replacement therapy, that it's not as dangerous. It was thought as far as creating breast cancer by these huge percentage numbers. A lot of women were quoted a 25% increased risk of breast cancer. In reality, it's about just a couple of women per 1,000 women for 3 to 5 years of hormone use. It's just not as rampant as a lot of people were led to believe. And there's a lot of advantages of hormone replacement therapy. But if you're taking hormone replacement therapy, you're not going to feel those perimenopausal changes the same way. And your breast tissue is going to stay dense and youthful. You're not going to have the decreased density and the softening and the changes. So if you are supporting your hormones and you have discomfort in your breast tissue, that's probably not going to go away if you continually take the hormones.
The reason we're here talking about breast health is, according to CDC, about 10% of new breast cancer cases in the U.S., they occur under the age of 45. We really wanted to debunk the myth that this is a cancer that happens to only older women. And I think you've done such a wonderful job at letting us know the takeaways here, the healthy lifestyle, the self-test, and just being aware of your own body. And I do have one last question, though. As women get older and they've done all this stuff, it doesn't mean after 62 or after these times you should stop checking your breast.
As we're living longer lives with healthier, better quality of life, even with hormones, sometimes people ask, well, when do you stop doing mammograms, or when do you stop doing checks for this? Usually the medical answer is if we think you have fewer than 10 years of life to live, we usually say, well, let's stop looking at this point. Or if there is a medical condition that would make treatment not possible. If somebody couldn't tolerate a surgery or a medical treatment, well, then there's probably no point in looking around for something. But other than that, as long as you have good quality of life and health, then, being vigilant about it and bringing something that stands out to you as different to your doctor's attention, especially with imaging.
As long as you have boobs, you should keep checking them.
Yeah.
I think the takeaway for me is just awareness over anxiety, because I think there's just so much anxiety out there. And whether it's from, lack of information or too much information, I think it's just so easy for us to run away and think,
yes,
oh my God.
And it's probably not cancer.
Yeah.
It's probably not cancer, but let's just get it checked out.
Yeah.
Dr. Heather, thank you so much for joining us. I think you've done
so
such a wonderful job lowering anxiety for a lot of people out there, and also taking us through the process of going to a mammogram, not being afraid if you have anxiety around doctors, and you really lowered it so that people feel welcome and can go do it without such high anxiety.
Yeah, we love what we do. We have the best staff. We have the best patients. We have so much fun. We have so many good, happy stories where things are taken care of successfully and people go on to live beautiful, long, productive lives.
Okay, so we are actually going to take our own advice and actually find out how to properly check our breasts, how to do a self-exam, doing one of those things again to learn the baseline of what your breast might feel like, so that if you feel something different, you can take action at that point.
When you start your breast exam, actually, everybody talks about feeling. Don't forget you need your eyes for your breast exam too.
Oh, okay.
So getting in with a mirror and getting in front of a mirror and putting your arms up, inspecting your breast, looking to see, do you see any skin changes? Do you see any rashes? Do you see anything in the folds? Are your breasts even? Is there any area that there's shadowing or dimpling or anything that's being pulled up or in? So those are things that we want to be conscious of too. When we're talking about examining the breast tissue, we're not talking about just everybody kind of concentrates on the center. And we want to remember that things can happen anywhere where there's breast tissue, and you can have breast tissue from your collarbone to your armpits down to the top of your abdomen area. So we're going to get all the way around there. Whee, fun. So you can start by putting one arm up and whichever hand you want to use. You're going to be using like the pads of your fingers, this part, not your fingertips, like 3 fingers, and you're using this part of your finger, not the very end of your fingertips. Important for those ladies out there with those gorgeous nails too. You don't want to be poking anything. So when you're looking, you can use small circles or you can use strokes. You do want to you want to vary your pressure. You don't want to be just pressing really hard, and you don't just want to be just barely tickling the surface. You want to vary your pressure. You want to press a little bit around. You want to do it in 2 different directions. So when you're checking yourself, you can either go all the way down and up, and then all the way side to side. That's one way of doing it. Or you can do it around like the petals of a daisy and then go back around like a target. Those are 2 ways of doing it, 2 good ways of doing it. And you want to check your underarm area. And for the most part, where you apply, if you use deodorant, where you apply deodorant, or if you shave your armpits, where the hair-bearing area is in your underarm area, that's usually not a place where there's deadly breast disease for the most part. If people feel lumps or tenderness in this area, we're happy to check it out, but it's usually not going to be, it's not a common place at all for any significant breast cancer or significant breast disease. For the most part, when we're talking about lymph nodes, they're usually lower down in that soft, hollow area, right outside your breast, right at the bottom of your armpit. That's in the general vicinity of where along that muscle stripe or the strip of muscle you can feel right there. That's where the lymph nodes that that monitor the breast tissue tend to be. So if you feel a slippery lump in there, it can be totally healthy. It can be just a normal lymph node, but that's something where you might want to check that out. Now, lymph nodes can be a little tender if you touch them, just like if you close your eyes and try to touch your eyeball through your closed eyelid. It does not feel good, but there's nothing wrong with your eyeball. So if you press on your lymph nodes in your underarm area and they're sore or tender and they feel like an unusual, like an uncomfortable pressure, that's not bad or dangerous. It's probably just normal lymph node. If you want to get it checked out because you've never felt it before, it feels weird or strange, feel free to call your doctor, and ultrasound is a great way of checking that out. So we just want to make sure that when we're checking our breast tissue, we are going beyond the boundaries of just the round area. We want to go below the bra line. We want to go to the center of the chest. We want to go up to the collarbone, making sure we're checking all around. Around at the end after we've checked in both directions. Check the nipples. Is there any discharge that comes out? Do you feel anything in the nipple? A little tenderness in the nipple, not dangerous or anything that sends up any red flags up my flagpole. Discharge can be really common. The pattern of the discharge is more concerning than if there's discharge at all. If there's lots of different colors of discharge, if it's multiple little ducts, multiple little droplets on multiple parts of the nipple, and especially if it's both nipples, that's usually just the natural fluids that are sitting there inside of our nipple ducts. We're not dry and dusty on the inside. There's just fluids that naturally accumulate in the hollow tubes that are there. So if you press on it, some stuff will come out. If you've ever breastfed or had a baby, even if it's been a couple of years, sometimes if you press an exam, you can get a little milky discharge to come out. That's not necessarily bad or dangerous. If it's just one duct and we barely touch it and it comes, a heavy amount comes out, especially amber colored or very clear and watery or bloody, and it's just from one area, we probably want to check that out, make sure that's something safe. Even bloody nipple discharge, about 98% of the time, is not cancer. It's usually a healthy growth inside of a milk duct called a papilloma. So lots of healthy reasons to feel things. If you felt kind of all the way around in 2 directions and under the underarm, you've done the other side and didn't feel anything. Lumpy, tender tissue, especially in the upper outer portion, really common. Tenderness a little bit on the sides and along like the bra line, very, very common. Again, not sending any red flags up my flagpole, but happy to check it out for anybody who's concerned. Once you've done all that and you've inspected in the mirror just to look for any changes, it's good to do that once a month. The best time of the month to do it is after your period. So if your period is day 1, to do it the week after your period, like day 7. It's going to be when things are the most calm and soft and the least painful or tender.
Okay, wait. So this boob feels different than the other one.
Okay.
Like maybe if there was like a bubble of water moving around?
Mm-hmm. It could be something like a cyst. Is that something you want me to check?
Sure.
I just feel healthy tissue. I feel your implant. I feel a ripple in your implant right here.
Oh, is
That's what you're feeling. Hold on a second. Right there. So sometimes you can have a weaker area or in the capsule around the implant where, think about it like a hole in your jeans.
Yeah.
If you're standing up, in certain positions you feel it more, in certain positions you feel it less. If you're standing up, you don't really appreciate it, but when you sit down, your thigh bulges through the hole in your jeans. Mm-hmm. So I think you're feeling that. I think that's just a little herniated part of the implant is what I'm thinking just on my fingertips.
So that leads me to 2 questions. Women with fibrocystic breasts or denser breast tissue, is the way you do the exam still the same? Is there something maybe extra they should be doing or extra they should be looking for?
It It might not be a bad idea if you have very complicated breast tissue to consider doing it both sitting up and lying down. That can also, you can roll on your side to kind of let the breast tissue move around on your body, so you're getting it where it's kind of the thinnest. If you're very large breasted and all of the breast tissue kind of is in one place, perhaps rolling around, like rolling on one side to feel at it from the side so that it can thin out a little bit would be helpful. So if there's a lump there, it'd be more noticeable.
And so my second question was pre-40, pre-mammogram time. Because I know every time I go and do my yearly, wellness exam, they do kind of hand check. Is it necessary, or is it advised to maybe in your annual wellness test, maybe go a little bit beyond, maybe do an ultrasound, maybe see, or is that kind of hand one and your monthly checks enough for before you turn 40 and you're getting your mammograms?
I see patients all the time that are healthy and don't have family history and maybe don't even have, very significant breast density at all, but they just want to get checked out. They just want to kind of look through, or, they're also curious. It's not all centers will do this, but we love to show people what we're seeing at the same time. Like, hey, you feel something, let's feel it, look at it together. Feels like I think it's just a little healthy piece of a fat lobule. Let's look together. Oh, look, I can wiggle it with my fingers. That's a piece of fat. Look at it wiggling. That kind of interaction. We love that.
And it helps to know what a mass actually feels like. I still have that image in my head, not image, but I still know exactly what it feels like.
A lot of people are given that little model that they can feel, and it's like, it should feel like a pencil eraser. And it can be any size, it can be any texture, it can be any depth. It's just, again, something that usually is hard and painless and is something you've never really appreciated before, or a change in your breast that's kind of come gradually over time and isn't going away. Now, there can be safe reasons for all of those things, but those are the things we really want to get checked out.
This has been super informative. If you're like me, you learned so much today. So I want to say a big thank you to Dr. Heather of the Bedford Breast Center. She'll actually be in the comments if you have any burning questions that we didn't talk about today about your breast health or anything else. Maybe Dr. Heather will be able to jump in and answer some of them for you. But again, big thank you. I think what we took away from today is it is important to check your boobies, do a little feely feel, get some help. But we'll be back, of course, next week with more episodes and more headlines that we're breaking down for you.